Welcome back to the Unseen Wisdom. We're all about digging deeper, and today we're going to Burkina Faso.
Yeah, a really fascinating story developing over there.
For sure. It's, Burkina Faso's new Bobo-Dioulasso University Hospital Center, or CHU.
The CHU, it's ambitious. I mean, this could really change healthcare in West Africa.
Totally. And what really caught my eye, I think, is like the scale of it all. We're not talking about just like a little upgrade here. This is Burkina Faso aiming to be like the benchmark, the whole region.
Yeah, they want to draw patients from all the surrounding countries, show off what they can do.
Exactly. And behind all this is President Ibrahim Traoré. He is really committed to improving people's lives, and especially when it comes to healthcare.
He really is. There's actually a great quote from him where he says, "Healthcare is not merely a service, it is a fundamental human right."
I love that quote. It's so powerful, and it really shows just how dedicated he is to this project. But let's get into the details a bit.
Right.
This hospital's huge right? Give us a sense of the size and scope.
It's massive. The CHU is planned to have 500 beds, 9 different functional areas. And we're talking everything from consultation and emergency services to hospitalization. There's going to be cutting-edge tech there.
Wow.
Yeah, and they've even got dedicated training spaces for medical professionals. Oh, and get this, residences for the Chinese medical experts who are partnering on the project.
Hold on. Did you say Chinese medical experts? Now, that's really interesting to me. It sounds like there's more to this partnership than just money.
Definitely. The collaboration between Burkina Faso and China here is something special. China isn't just funding this 60 billion CFA franc project. They're also bringing expertise to the table, transferring technology and offering a fresh perspective.
So Burkina Faso is using this partnership to build a hospital and learn and grow along the way. Smart.
Exactly. It's a strategic approach to development, for sure. This isn't just about treating sick people. It's about building a stronger healthcare system for the whole country, one that can stand on its own 2 feet.
And, this is where the material we're working with today gets really exciting. We've got some amazing footage and transcripts from Intervlog that give us an incredible look inside the project, the construction and the vision behind it all.
It's some really remarkable insight into the project's development.
Yeah.
What really stood out to me was this focus on the CHU as like a hub.
Okay.
A central point that's going to create positive ripple effects across the entire country's healthcare system.
Yes. Tell us more about those ripple effects. I think our listeners would love to hear how one hospital can have such a big impact.
Well, imagine this. You have this specialized care center drawing in patients from all over the region.
Okay.
So this frees up the existing hospitals to focus more on primary care.
Makes sense.
It's like a decongestion effect. You're improving healthcare access at every level.
So it's a chain reaction, starting with the CHU and then spreading out. It's not just this one building. It's about making the whole healthcare system stronger.
Exactly.
Mm-hmm.
And then remember those training spaces I mentioned. Training the next generation of Burkinabe doctors and specialists within the CHU is key to this whole plan.
Oh, yeah, for sure.
It's about reducing the reliance on experts from other countries.
Right. I wanted to touch on that, too. It's a really clever way to make this project and the healthcare system sustainable in the long run. It's not just about building a hospital. It's about investing in Burkina Faso's healthcare future.
Absolutely. And that investment goes beyond just medicine. Think about the jobs created by the construction.
Right.
And once the CHU is running, it'll need a whole workforce. Doctors, nurses, administrative staff, support staff, and the boost to local businesses from all the activity, it's huge.
It's a really impressive multi-pronged approach to development and brings us back to that partnership with China. It's clear they're not just taking the money, they're really trying to learn and adopt the best practices.
Absolutely. Burkina Faso's Minister of Health, Dr. Jean-Claude Kougou, has praised the Chinese company involved for their professionalism and dedication. He even called it an example for Burkinabe companies to follow.
Wow, that's a powerful statement. It's like they're saying, we're not just taking your money, we're studying your methods, and we want to be as good as you. That's ambition.
Exactly. And that ambition really speaks to President Traoré's vision for Burkina Faso as a whole.
Okay, so let's talk about that vision a little bit more. What does this project tell us about President Traoré's goals for the nation?
Well, he's not interested in just surface-level improvements, short-term gains. He's aiming for real change, building a nation that can stand on its own.
That theme of self-reliance keeps coming up. It seems central to his philosophy.
It really does, and the CHU is a perfect example of that philosophy in action.
Okay.
He's investing in healthcare, education, local expertise. He's setting Burkina Faso up for a future where they don't have to rely on outside help. They can control their own destiny.
That's a bold vision. It takes a lot of planning and commitment to pull something like that off. It's not just about dealing with problems as they come up. It's about shaping a better future.
Exactly. And the CHU's role in that future, it's much bigger than just a hospital.
Right. It's like a symbol of progress, of ambition, of a nation trying to find its place on the world stage.
And it looks like it's working. The material we have highlights how well the construction is going. They're sticking to the deadlines. There's a real sense of competence and efficiency.
You know, it's easy to be cynical about these big projects, but this one feels different. It feels like a real win for Burkina Faso, a sign that they can deliver on their promises.
That sense of accomplishment is huge. It builds confidence, encourages more investment, and inspires people to believe in positive change. The CHU is scheduled to be finished in March 2025, and it's on track to be a major symbolic victory for Burkina Faso.
It's a powerful message to the world and to the people of Burkina Faso. It says they are ready to lead, to innovate, and to take control of their future. But what about the people who will actually use the hospital? How will it change their lives?
That's a really important question, and it leads perfectly into our next segment where we'll dive into the social impact of the CHU and how it'll address the needs of everyday people in Burkina Faso.
Stay tuned, folks. We're just getting started.
Welcome back to our look at Burkina Faso's incredible step forward in healthcare, the Bobo-Dioulasso University Hospital Center, the CHU. It really shows a vision of progress and self-reliance.
Yeah, it's been fascinating to unpack all the different aspects of this project, the technology, the training programs, the ripple effects across different areas. But I want to talk about the people. How is this project going to affect the everyday lives of people in Burkina Faso?
That's the important question. Think about a family in a rural village. What does it mean for them to have access to specialized care without having to travel for days and spend a lot of money?
Right. It's about getting rid of those obstacles to essential services. For people in remote areas, those barriers can seem impossible to overcome.
Exactly. It gives them hope. They can believe that quality healthcare is possible no matter where they live.
You know, some of those interviews we saw from Intervlog with locals really stuck with me.
I know what you mean.
They were so excited and grateful for this project. It's clear that the CHU is a symbol of hope, a sign that things are getting better.
That hope is so powerful. And it comes with the real improvements that the CHU will bring to people's lives. Imagine a parent knowing that their child can get specialized treatment without having to leave their community.
It's about making society stronger, giving people a safety net, and creating a feeling of shared well-being.
And the impact goes way beyond individual families. If the population is healthier, it can have a huge positive effect on Burkina Faso's development as a whole. A healthier workforce means a more productive workforce, and that leads to a stronger economy and more prosperity for everyone.
It's like a domino effect. Progress starts with healthcare and spreads out to touch every aspect of life. So let's talk more about the healthcare itself.
Yeah.
What kind of technology are we talking about in this state-of-the-art facility?
Cutting-edge equipment across a range of specialties. For example, they're going to have advanced imaging technology for diagnosis. Doctors will be able to see inside the body with incredible detail and accuracy.
Oh, wow. Yeah, it can be life-saving when it comes to early detection and treatment.
You know what's striking to me is that these technologies just haven't been available in Burkina Faso before. People had to travel abroad for certain treatments, which costs a lot of money and really disrupts their lives.
It's true. The CHU is bringing world-class healthcare to the people of Burkina Faso so they don't have to go through all that.
It's about bringing healthcare home, making it something everyone can access.
And that accessibility is a big part of President Traoré's vision for a more equal and self-reliant nation.
Yeah.
He doesn't want to just copy existing healthcare models. He wants a system that actually meets the needs of his people.
Speaking of President Traoré's vision, we talked earlier about the CHU as a regional hub that would attract patients from neighboring countries. What does that tell us about Burkina Faso's ambitions on the world stage?
Well, it shows that Burkina Faso wants to be a leader in healthcare.
Okay.
Not just within their own borders, but across the whole region. They want to showcase their expertise, attract medical talent, and build a reputation for excellence. It's a bold move. Could have some serious geopolitical implications. If they're providing high-quality healthcare to their neighbors, Burkina Faso can strengthen those relationships, improve its standing in the region, and maybe even help solve regional health problems.
It's bigger than just medical diplomacy. It's about fostering cooperation, building bridges, and positioning Burkina Faso as a valuable partner on the world stage.
This project is just so multi-layered. We've talked about the technology, the regional impact, the economic benefits, But what about the people who will be working there? We touch on the training programs, but tell me more about how the CHU is going to develop the next generation of medical professionals.
The CHU will be a real training ground for medical students, nurses, and specialists. They'll get hands-on experience using cutting-edge technology and learning from some of the best minds in medicine worldwide, including those Chinese experts we mentioned earlier.
That exchange of knowledge across cultures is invaluable. It's not just about technical skills, it's about broadening perspectives and encouraging innovation.
Exactly. This kind of training will not only create a highly skilled workforce, but it'll also help Burkina Faso rely less on foreign medical expertise.
So it's about empowering local talent, giving them ownership over their healthcare system, and ensuring that it's sustainable for the long term.
It's a powerful message. Burkina Faso is investing in its own people, giving them the skills and knowledge they need to lead the nation to a better future.
This deep dive has been so eye-opening. We have explored the many ways the CHU can make a difference, from its incredible technology and regional influence to its potential to change the lives of everyday people. But like with any ambitious project, there are going to be challenges along the way.
That's true. And in our final segment, we'll address those challenges head-on. We'll talk about the potential hurdles, discuss what it takes to make a project of this scale truly sustainable, and examine President Traoré's vision for Burkina Faso's future.
Stay with us as we continue our exploration into the unseen wisdom of this remarkable endeavor. Welcome back to the Unseen Wisdom. We've really been on a journey, haven't we, exploring Burkina Faso's amazing Bobo-Dioulasso University Hospital Center, the CHU.
It's quite the project, isn't it? A symbol of progress, of working together, and of a nation that wants to forge its own path.
We've talked about how the CHU can change healthcare, boost the economy, and even raise Burkina Faso's profile on the world stage. But now let's talk about the challenges. It's one thing to build a hospital this big, but keeping it running successfully in the long term is a whole other story.
That's a crucial point. Sustainability is key. We have to look beyond the initial investment and think about the ongoing costs of running such a complex facility.
Absolutely. Staffing, maintaining the equipment, getting medications. The list just goes on and on. So how can Burkina Faso make sure the CHU stays a success for years to come?
Well, it all starts with solid financial planning and management. A realistic budget, finding different funding sources, and having transparent accounting practices.
It's about being responsible with the resources, making sure every dollar spent on the CHU actually benefits the people it's supposed to help.
Right. And then there's the challenge of finding and keeping qualified medical professionals. Competition for skilled healthcare workers is tough everywhere.
So it's not enough to just have this incredible facility. They need to create a place where top talent wants to work. How do they do that?
Well, competitive salaries are definitely important. But it's more than that. It's about professional development opportunities, a supportive work environment, a clear sense of purpose. Those are the things that attract the best people.
They need to build a community, a shared commitment to excellence. People need to feel like the work they're doing at the CHU is actually making a difference.
Exactly. And one last thing to consider is equal access. We talked about how the CHU could bridge the gap between urban and rural healthcare, but that takes planning and outreach.
We need to make sure that everyone benefits from this world-class facility, no matter where they live, how much money they have, or anything else.
Exactly. That might mean figuring out transportation solutions, setting up programs in remote areas, maybe even creating satellite clinics linked to the CHU. Everyone who needs specialized healthcare should be able to get it.
It's a complicated undertaking, but it's crucial if the CHU is going to live up to its promise and truly improve the lives of everyone in Burkina Faso.
And that brings us back to President Traoré's vision. We've seen how the CHU represents his dedication to self-reliance, investing in people, and building a better future for his nation.
Throughout this whole discussion, I've been struck by how this is about so much more than just a hospital. It's a symbol of Burkina Faso's ambition, its strength, and its belief in its own potential.
It shows what can happen when a leader has a bold vision. A nation comes together to support that vision, and partnerships are formed to make it a reality.
As we wrap up, I'm feeling really optimistic. Even with all the challenges, progress is possible. The CHU is a great example of that. It's inspiring.
It reminds us that we can find wisdom in unexpected places. If we look beyond the headlines and dig deeper into the stories that shape our world, we can understand the human spirit and the power of working together so much better.
Thank you for joining us on this journey of discovery. We hope we've made you curious, inspired you to think in new ways, and maybe even given you some hope. Keep searching for that unseen wisdom that's all around us.